Well, COVID-19 cases continue to rise in the U.S.
But vaccines and immunity from prior infections have adjusted the way our bodies react to the virus that causes the disease. As COVID-19 cases in the U.S. go up, the risk of hospitalization or death from the virus since the height of the pandemic has gone down. An estimated 97% of Americans either have some immunity from prior infection or through vaccination. According to the U.S. Centers for Disease Control and Prevention, still new infections are happening every day and may be driven by people heading inside and schools being back in session.
And that is usually what kicks off respiratory virus season. And that's where we are right now.
Health experts say the danger from COVID-19 is still there. CDC data shows about a 22% uptick in hospitalizations and deaths in the most recent week of data. Still, that's lower than in years past, and it's a large jump because cases were low before the uptick. But the threat of new variants remains. Scientists are keeping an eye on BA.2.86, which has been picked up in very low levels of U.S. wastewater, to see if it's more infectious or if it causes more severe disease.
And UW Health's Dr. Jeff Pothof is here with his weekly visit, and we're hearing about COVID and slight increases, but is it a cause for concern at this point?
I think concern would be the wrong word. Not unusual that as we go into fall we see some more COVID, but the environment's so much different than what it was during the pandemic. Most people have some underlying immunity, and we're doing better with COVID. It's not to say that those who are extremely susceptible, immunocompromised, shouldn't be taking precautions, getting boosters and things like that, maybe even masking, but for most of us, not as big of a deal as it used to be.
So, but still, get the vaccine this fall.
Yeah, absolutely. I mean, do what you can to protect yourself against severe disease, and that will be getting this booster that likely we'll know more details about middle of September, probably available in October.
Yeah, and of course it's always important to be mindful of immunocompromised people still.
Absolutely. They are at high risk. They don't get the benefit of previous infection, previous vaccination. They're just as likely to have a bad outcome as they were when all the rest of us were pretty COVID naive. So those people need to take caution. And then I'd like to say the rest of us should probably do what we can to try not to make those people get sick and have bad outcomes too.
Let's turn to this new study from Boston University about CTE, and amateur athletes are getting CTE in larger numbers than we'd like.
Yeah, this is interesting. So CTE, or chronic traumatic encephalopathy, is typically a disease we associate with American football players. And it causes some behavioral things, and oftentimes these folks can sometimes have violence tendencies, or they commit suicide. And now there's this large study coming out of Boston that looked at individuals, and this wasn't a random selection. These were definitely individuals that were young, under the age of 30, who I think families must have thought maybe there was something going on. And the fact that they need to be passed away so an autopsy can happen is interesting. But they had exposure to traumatic or collision sports, most often football, sometimes soccer, sometimes hockey. And they found a pretty high rate of even these young brains, sub 30 years old, with findings consistent with chronic traumatic encephalopathy. So it doesn't seem that this is just something that's going to affect football players that play at the professional level, but maybe even kids at that high school or even lower level, kind of making us think more carefully about how do we protect these kids from these types of sports that a lot of us enjoy, but potentially have some associated health risks.
Yeah, and I bet a lot of parents are thinking about that this time of year.
Yeah, absolutely.
So what can you do?
Yeah, I think what you can do is you want to try to avoid having those concussions, and if you are going to sign your kids up for contact sports, you have to make sure that all these safety precautions are in place. But right now, I don't know that there is a 100% way to say that these contact sports are completely safe, but at the same time, there are a lot of things in play to try to reduce the impact of repetitive head trauma on these participants.
Is it important to, if you do take a hit, for parents to monitor their kids even several hours afterward?
Yeah, I think for sure. So if someone takes a hit, you want to make sure that they're returning to their baseline relatively quickly. I think more importantly, and particularly related to the CTE discussion, is we know that someone who has had a traumatic brain injury, so maybe a concussion, mild, right? We want them to fully recover before they have another insult. So I think one of the things we can do is, if you have someone who plays football or hockey or soccer and you know they had a concussion, don't have them go back out there the next week until those symptoms are completely resolved. That could lead to problems downstream.
Yeah, pro football players are getting these, and they have these $1,000 helmets. Well, they don't have that equipment at high school level.
They don't, but at the same time, they don't have the same energy at that high school level either. So it's a wash, but I mean, yeah, I think before, growing up, I don't think when I grew up we worried about football or these other sports potentially having these problems. now it's kind of front and center, and I think over the next 3, 4, 5 years, we'll learn more about how we protect our kids in these sports.
It's good to be aware. That's for sure. Doctor, thank you.
Thank you.
See you next week.
Yep.